Doctor, I'm sure you see a lot of herniated discs in your practice. So how are you helping people who are suffering with that condition?
Well, it's true. I do see a lot of patients with herniated discs. In fact, I have quite a few right now that I'm treating, and again with great success. And the problem is, as we see these low back complaints coming in or neck complaints, because the herniated disc can occur there as well, we find that the bones have shifted out of place. And in many cases, they've been out of place for a long, long time. And what happens is the disc in between, which is like a shock absorber, has nowhere to go. It has no way to move. And because there's no movement, it can't receive the nutrients that it needs. And now you have this constant pressure, and this pressure causes them to bulge or to disintegrate and degenerate. And we have a lovely model right over here that shows exactly how that happens. Here you have a nice disc, but because of the bones shifting out of place, over here you now have the disc is starting to thin. You can see it bulging out a little bit, as well as thinning from this one over here.
Right.
If nothing is done, then it'll either start to bulge out even further, or as it shows here, it'll disintegrate and cause pain in that way, pinching the nerve back here.
Right.
You can see this nerve can be pinched either from arthritis resulting from the disc problems, or this disc actually can start to push out, again putting pressure on the nerve. So we're going to take the pressure off that nerve by healing that disc. And we do that in a variety of ways. Of course, we want to put the bone back into place so that there is no more trauma to the disc area and it can start to heal. Secondly, we're going to try to break up scar tissue, and we like to do a lot of traction to help that disc kind of pull back into itself, because it's ballooning out. We don't want that because that's causing the pressure. So by doing that, we've had great success with the patients we've seen in the past and continue to do so.